Navigating the myriad of choices in our current medical system is often overwhelming and confusing, and often a bad decision is based on incomplete or inaccurate information. The internet only compounds that problem with websites like HealthGrades, RateMD, ZocDocs, things like that. They're no more than popularity contests for doctors and don't really tell you what a specific doctor would do with a specific outcome. That's where Concierge Nurse Navigators comes in. My wife recently needed a hip replacement, and we were looking at 4 or 5 different doctors. We sent that list of doctors to Concierge Nurse Navigators, and we got back results that were shocking. Some of the doctors that were highly rated on the internet-based rating systems had some of the worst results and worst outcomes. And so what we did, we went to the doctor that had the best results and best outcomes. And lo and behold, my wife had a hip replacement. And within 5 or 6 hours after the new hip was installed, she was walking up and down the hall, went upstairs, downstairs, up a ramp, down a ramp. They even have a car at the hospital that she used so she could get in and out of the car with her new hip. Anyway, the results from Concierge Nurse Navigators were absolutely phenomenal. I can't say enough good things about them. I would hardly recommend that anyone who needs any type of surgical procedure use them unequivocally.
What fulfilled you about having your own benefits practice?
Basically helping people and not having someone tell me what to do besides my customers.
Gotcha.
And my wife.
Yeah. So one of the things I've always been grateful for is how gracious that you've been to me as a human being. And I know that we've talked about that a lot, and it's more of I work with some people because I have to, but with you, I'll bleed for you because I want to, just because of how grateful I am for our relationship and how you've treated me as an individual, but also as a professional. So thank you for
appreciate that.
You know, one of the things we're here today is to talk about the experience that you had using a nurse to help you find the right doctor. And can you give a little bit of a sprinkle of history without sharing PHI about your own journey, if you wouldn't mind?
The journey primarily hinges around my wife, who's had hip and back problems for probably 10 plus years. And she would go see a hip doctor, and the hip doctor would say, "Oh, it's your back, honey." And then the back doctor would say, "Oh, no, it's your hip, honey." And she went back and forth and back and forth. And she got MRIs, she got x-rays, she got injections in her hip, she got injections in her back, and really no permanent pain relief. And finally, she went to a particular doctor that does hip replacements, and he took a particular x-ray and looked at it, and it became very obvious to us what the problem was. And so anyway, at that point in time, I got in touch with you because I read a post on Facebook about your wife who had a particular medical issue, and you had contacted the company called Nurse Navigators, Concierge Nurse Navigators, and they had given you and your wife some amazing advice, and essentially may have saved your wife's life, and the life-changing, I know, for your family. And so the hip replacement is not nearly as significant as what you and your wife were dealing with, but it certainly is significant for the person who is having the surgery. Years ago, someone gave me the definition of minor surgery, and you know what it is?
What's that?
Surgery on somebody else.
Well said.
Anyway, so
Fish, let me ask you, because what I heard you say was your wife had significant back pain, kind of bounced around the healthcare system, trying to find a helpful doctor.
Right. And she met several that basically she thought were just sloughing her off. And you and I don't encounter that problem, but as a female, she felt that a lot of times she is not treated as respectfully as a male patient. And I think she's probably right.
Yeah, I totally understand. And I guess my question for me is, what did you do to try to find the right doctor before the Nurse Navigator came into play?
Well, we go to health grades, we go to ZocDoc, we talk to other people about their recommendations, and basically it was recommendations, health grades, and ZocDoc. But those all, as I said in my testimony, are basically popularity contests. So basically, people write about their doctor, whether they had good bedside manner or they, had a nice staff or a clean office, but they didn't focus on outcomes. Right. And the nurse navigator that we worked with, the great thing that they did is they not only focused on who the good doctors were, but which doctors had the best outcomes. Because a doctor can be a real jerk, but if he has a good outcome, you really don't care.
Yeah.
Would you rather deal with a doctor who was personable, who had horrible outcomes, or a jerk that had great outcomes? And so the ideal thing would be a nice doctor that had good outcomes. But in our particular case, the nurse navigator recommended 5 doctors we set up, and that ranged from 95% positive outcome down to less than 50%. And ironically, the ones that were less than 50% were some of the ones that had the highest ratings on health grades. It made no sense at all. So
isn't that crazy?
We went and saw this particular doctor, and the nurse navigators even took the step where they said, we not only recommend these 2 doctors, but if you use this doctor, we recommend that you go to this hospital, because the what facility you use can often have a significant impact on what the results are. So we went to a doctor that had a 95% positive outcome, and we went to the hospital that they recommended. And my wife checked into the hospital at 5:30 in the morning, had the surgery at 7:30, went into recovery at 9:30. At 11:30, she was up walking down the hall. And at 1 o'clock, we were home with a new hip.
Wow. So Bill, I guess what I misunderstood is, along the way, what I heard you say is you had collected a lot of information on what you thought were good doctors, but no quality information online whatsoever for you to help you in your journey. Is that correct?
That's correct.
So you presented a list to the nurse, and she said, hey, of these 5 or 10, these are great, stay away from these. But with these selection of doctors, this is where they have the best team. So the hospital that actually has the lowest infection rate, best outcomes. How did that help you in your journey?
Basically, my wife was able to meet with the doctor, meet with the doctor's staff, and be very comfortable with what he was going to do. Got the appointment for the surgery quickly, had the surgery. Obviously, it's been successful to the degree that my wife played golf last weekend 4 weeks after she got a new hip, which probably the doctor wouldn't be happy about. But this particular doctor just said there's certain things that you can't do, and golf is not one of them. So anyway, my wife is delighted.
Well, I saw her swing, and I'm thinking you might have given her some pointers.
Yeah, probably not.
So I guess what I would say, Bill, is knowing that you've been in this industry for 30 years, is this something that you would recommend to your clients?
It would certainly be something I would recommend, and not only recommend, but encourage people to do. Because if you have any type of surgery, what you want is a positive outcome. And if you don't go to a doctor that has good outcomes and use a hospital with a low infection rate, the chances of you having a good result are not as good as if you use someone like Concierge Nurse Navigators. They are phenomenal. They are responsive, and they gave us great advice. And I can't say enough positive things about them.
Wow. Thanks for that, man. So I guess one final question is do you think you might have used one of those poorly rated doctors without having a nurse navigator to help you pick the right one?
Definitely. Because without their guidance, we could have gone to a doctor and had a problem with a hip replacement. And it's certainly had a very positive impact on our entire result. My wife is grateful, and I as well, because I was her caretaker.
Thanks, man. Fish, thank you, dude.